Well, lately we've been hearing a lot about ambulance response times in the city of Buffalo. But what about the suburbs?
News 4's Luke Moretti reports that places like Lancaster and Orchard Park are getting good response times with a combination of paid and volunteer staff.
At any moment, someone somewhere is going to call for help. When it comes to providing emergency medical care, whether it's Buffalo or surrounding suburbs, the goal is the same.
We're here to save lives.
In Erie County, there are multiple agencies that provide advanced life support and hospital transports.
We've got a medic that's responding already.
Tim Benstead arrives at an assisted living facility in Orchard Park.
We have one paramedic inside already.
Benstead is the operations manager for Orchard Park Fire District EMS, a completely separate, not-for-profit organization which works in conjunction with the town's volunteer fire companies.
The volunteer fire company brings the ambulance to us at the very least, and then we're able to take care of the patients and proceed to the hospital as needed.
It's a hybrid model established in 2009 because of increased call volume, training demands, and a decline in volunteer membership. When it started, they were averaging about 1,500 to 1,600 calls a year. According to General Manager Anthony Ballister, they're now up to 3,400 calls a year. He says their average response time is about 4 minutes.
As crazy as it gets on some days, we've been very fortunate that we've been able to handle everything. And if it wasn't for the volunteer side being involved, there's no way we would have been able to handle everything.
Orchard Park's EMS operation costs over $1 million a year to run. They were faced with a choice: either contract with an EMS provider or become a paid service.
We're doing well enough to make sure that our employees are paid, that our building's taken care of, and that our trucks are being maintained, and we have the best equipment that we could possibly have.
Man down, coma part, possible overdose.
Here in Lancaster,
It's just so busy.
5,000 to 6,000 calls a year keep the Lancaster Volunteer Ambulance Corps rolling 24/7.
People just are constantly calling us.
Vice President Jeff Bono says the not-for-profit EMS operation was started 63 years ago because of response time issues. Today, they have 4 ambulances running 24 hours a day using paid and volunteer staff, with an average response time of 7 minutes or less.
The annual budget for Lancaster Ambulance is $1.8 million. We take in about $80,000 a year from donations. We get absolutely nothing from the town or any municipality. We're completely independent.
Bono says the operation covers the town and village of Lancaster and the village of Depew. But he says EMS is about saving lives and not about primary jurisdiction. The existing EMS system across Erie County, he says, needs to change.
It's not the best way to do it, but you have different fractured entities that are in charge.
Bono suggests one dispatching center for everyone so that providers, big and small, paid or volunteer, respond whenever and wherever they are needed.
It needs to happen yesterday, but I don't see it happening anytime in the near future because, again, people have their own piece of the pie and they don't want to give it up. They want to have the control over it.
And what Jeff Bono is talking about would be completely different than existing mutual aid agreements. Of course, who's going to run it? What would it cost? Is there a desire to make this happen? These are all questions that really need to be considered.
That piece of the pie everybody's protecting.
Right.
But you point out, so we have some communities here who are doing their own EMS dispatching.
That's right.
Is there a role here for Erie County to take the lead in this?
Well, it's funny you mention that. We actually sat down with the county's Emergency Services Commissioner and the chairman of the county legislature's Public Safety Committee. You're right. Something like this does require leadership, and we're going to hear from them tomorrow at 6.
Tomorrow at 6.
Yeah.
All right. Thank you, Lou.